Hi, welcome to another episode of Medicare Industry Insider. I'm Rachel Brandmeier.
And I'm Jalen Jackson.
And today we have a very interesting episode specifically on the topic of mental health. We'll go over the history of mental health, and you'll dive into the depths of the fact that it's been all over the place in terms of how people view it, what stigmas are tied to it, and then dive a little bit more into the insurance agent side, which is going to give you more resources, networking partners, and of course, services available to help your clients.
Absolutely. And I think first, just a little context, help us establish what we are talking about. So looking at mental illness, and there's a lot of definitions out there, a lot of, also called mental health disorders, but it really refers to kind of a wide array of symptoms and specific disorders that affect mood, thinking, or behavior. So some of the examples that we probably are really familiar with are things like depression and anxiety, but also things like schizophrenia, eating disorders, and even addictive behaviors. So lots of things that play into different mental health issues and mental illnesses, things that can result in extreme mood changes, confused thinking, withdrawal from kind of friends, activities, society, significant tiredness, feelings of fatigue or low energy, or feelings of insomnia, the inability to cope with daily problems or stress, in a kind of an outsized fashion compared to the severity of the problem. Things like excessive anger, hostility, or violence, or the use of narcotics and alcohol to, numb the pain, so to speak. So lots of different things can go into what makes up a mental illness or the symptoms that are caused by it. But it's something that has been around for a very long time. And I think it's safe to say that our views on mental illness have evolved quite a bit.
Oh, for sure. So we actually started digging into the history of mental illness. And the first name that we could find was hysteria. It actually dates back to 1900 BC. Basically, and this is going to be, just facts we're stating, but like the idea of what mental health is and who it's tied to has definitely changed over time as well. So the Egyptians actually coined the name hysteria, and they identified the cause of hysteria is spontaneous uterus movement. Basically, the uterus moved all over the female body, causing hysteria, mental illness. Basically, it was a female disorder, and this is the most interesting thing. It was considered a female disorder until Freud, especially with Freud considering an exclusive female disease, and that was over 4,000 years of history. So we just covered 4,000 years of history called hysteria, which was the mental illness specifically tied to women. And I think Freud just kind of took people back a little bit further by coining it specifically a female disorder as well. As we were going through, we actually started looking at different writings and articles. We kind of went into a nice big hole of digging about mental illness, and I brought up reading the short, it's like a very short story. It's called The Yellow Wallpaper. It was written in 1892, and basically the writer it's told from the female perspective of basically being locked up in this attic area of this house, and she's going insane, and in her head there is a person behind the yellow wallpaper that she has to help get out. And the whole time she's like pacing the room, peeling wallpaper off, and the crazy thing is her husband's a doctor, and that was his diagnosis, and his recommendation was to lock her upstairs. So yeah, it is kind of interesting. So over time, history has been definitely targeting women, and with the name hysteria instead of mental disorders.
And I think it points to for a long time, as even as we look at today, which we'll get into, mental health is still, I would say, a drastically underdeveloped field compared to things like basic germ theory, even things like oncology. I feel like mental health, there are still so many unknowns.
Yeah.
And especially at a time where, physical medicine was also still in its infancy.
Right.
1892, we're talking about a time where, sequestering was kind of the go-to. Mm-hmm. That was, whether it was mental illness or something like a leper colony, asylums, people that were different for some reason, medical or otherwise, like just sequestering.
Yeah.
Keeping them away from other people. And unfortunately, that that was kind of the method that we used for a lot of mental illness, was just keep them away from people and keep them, sedated in some cases, keep them quiet, calm.
Yeah, if you've ever watched American Horror Story, it's definitely kind of a fear of people, because it used to be a real thing in the late 1900s all the way through the 20th century. Asylums were a thing, and that's where we would put people. And a lot of those people, unfortunately, were people with like postpartum hysteria. That's another coined thing that now it's considered postpartum depression. There's a lot of I think a very large percentage of women have postpartum depression, and they understand it's a temporary thing, but at the time it wasn't. It was something where they'd say, oh, go to this asylum, and sometimes people wouldn't get out.
Yeah.
Because lobotomies were also practiced there.
Absolutely. And I think that, there was a lot of permanent solutions to temporary problems.
Yes.
In that day and age. And lobotomies, either removing or breaking down connections between parts of the brain, super common, especially in the early to mid 20th century. And it's crazy to say mid 20th century, but the last well-known lobotomy in the United States was performed in 1967, 2 years before we went to the moon. That's kind of nuts to me. But
we both, you kind of seen our jaws when we looked that up. We were like, what? 1967, I think both of our jaws dropped when we were like, lobotomies were happening all the way up to that point.
Yeah, absolutely. And just, really, really fascinating and terrifying history to read. Freeman was the doctor that performed many of the lobotomies around the country. He used to travel, had speaking engagements, had a huge following for a long time. But unfortunately, there were major, major issues with lobotomies, as we well know today. Often caused people with mental illnesses to become calmer. So if you had someone exhibiting violent tendencies, hyperactivity, something like that, it did technically calm them down, but it also caused a lot of significant changes in personality. Anything from apathy and social disinhibition to, borderline vegetative states.
Or death. We've run into that.
Death. Many, many times where procedures would go awry and you would have someone die of brain hemorrhages. For example, 1967, that last lobotomy was actually the third lobotomy performed on a single patient, Helen Mortensen, by Dr. Freeman, and she did die from a brain hemorrhage following a procedure. After a good 30 plus years of going around the country performing thousands of lobotomies, that was the one that caused them to finally take his medical license.
Yeah, no, it is crazy just to think about asylums and the why people went there. I mean, women used to go to asylums because they couldn't find husbands, and it wasn't considered an insane asylum, what we think of now, because now we see that people were going insane or getting lobotomies. But this might be too much information, but there's even a person on my husband's side of the family that ended up in asylum because she lost her husband, or lost the person she was going to get engaged to. I think he passed away or something, and she was an orphan basically and had no way to support herself, so she checked herself into an asylum. And my husband's mom remembers visiting her and bringing her baby dolls and lip gloss. So thinking about that comment, I'm wondering if she had some sort of lobotomies performed on her, if she was just so drugged up that it literally altered the state of her mental capacity. But you may have someone in your family that literally had an experience with an asylum if you're looking back at your history, because it was, like you said, it was a very common practice. If there was someone that had any mental disorder, any sort of strangeness, they would just put them in an asylum.
Yeah, absolutely. And I think, that's something that has unfortunately a long history, and even today to an extent. I think, when we start talking about institutionalization, even now today with all of the resources and information, I think unfortunately it is seen as a last best option for some patients when it may not be the best way to improve them. But, not being a medical professional, that's a tough call to make.
I mean, we even read Matthew Perry's autobiography where he goes about, going and checking himself in and out because he had drug and alcohol addiction. So, like you said, it doesn't always work for every single person over time. We talked about women and stigma. We'll dig a little bit deeper into men now, because I think the earliest situation or account of any man example of a mental health was actually from the tale of Gilgamesh, where they basically run into a situation where he is mourning and causing himself to have a mental disorder after basically war. So we'll dig into that a little bit. Mental health for men.
Absolutely. And, as much as it has always been acknowledged in the sense that certain people throughout time have recognized that mental illness or PTSD or things like that are a part of the human experience for men and women, there's also a lot of stigma around it for men. And luckily that is something that has shrunk drastically, I would say, over the last 5 years even. But still, unfortunately, a little bit of stigma. And a lot of that comes from most of the kind of closest thing to evidence-based research that we have at the time, in the time period, on male mental illness or mental health issues comes from war. So looking just in our own United States history of shell shock during the Civil War era turning into battle fatigue or combat stress reaction from the World War I, World War II, and then finally in 1980, after the Vietnam War, PTSD, post-traumatic stress disorder, becoming an actual recognized mental health issue. So it's something that has taken a long time to even become recognized as something other than a kind of aberrant reaction to a common experience. And I think that's maybe one of the biggest issues with men is it is seen as a lot of men going through similar experiences and a very small number reacting in this way. And that's one of the things that maybe made it take so long to start being recognized as this is a valid and real reaction to a very stressful situation.
Yeah, you would see a lot more of the symptoms and not the diagnosis, like the alcoholism, the anger issues, the medicating themselves after being shell-shocked or having PTSD, things like that. So it is interesting just to kind of look at how history, well, and I don't think Freud helped, but how history changes who is coined or stigmatized with mental illness, and then also the names or the different symptoms we were saying that was not actually diagnosed as mental illness that we consider now today.
Yeah, absolutely. And I think and again, continuing to talk a little bit about men and mental illness, it is, I think I'm going to go through some numbers, but I think what you'll see consistently is men are less likely to seek and receive assistance, even though men account for about 10% of medical patients with bulimia or anorexia. Men with eating disorders are statistically significantly less likely to seek help with that. Over 6 million men suffer from depression each year, but male depression oftentimes goes undiagnosed. More than 3 million men in the U.S. have a panic disorder, agoraphobia, or some other phobia. 2.3 million Americans are affected with bipolar disorder, and about an equal amount of men and women develop it, but men are more likely to develop it at a very young age, between 16 and 25. And unfortunately, one of the leading causes for disability in America is schizophrenia. Around 3.5 million Americans have been diagnosed, and 90% of those diagnosed by age 30 are men. So there are certain categories of mental illness or mental health issues that are drastically tilted towards men. And I think that poses a unique problem in both researching these issues, treating these issues, and then making sure people have access to resources.
Absolutely. So if we're going to continue on, we'll kind of table the men and women history for a little bit, because we're going to go into recent history, which I think we're recognizing both men and women both have mental disorders. We had COVID, where one of the biggest things that happened was isolation. And that doesn't help at all if people have mental disorders. In fact, after COVID, they did a study and about 25%, this was a World Health Organization study, 25% of people had anxiety and depression from COVID, being basically isolated. And then in 2021, a study said that nearly half of Americans surveyed reported recent symptoms of anxiety or depression disorder. 10% of those felt their mental health needs were not being met. So in addition, like one of the things that if you even look at people, I mean, isolation is causing them to lose their community, losing people to talk to. Maybe they're isolated with, it's kind of like the woman in the yellow wallpaper. She's isolated. She goes crazy. I think a lot of people felt the ripple effect from COVID, not just from the actual disease, but from being isolated.
Absolutely. Well, and so many things like that, especially for folks who may have already been suffering with mental health issues, sudden and drastic changes to routine. Things like virtual schooling for youth that are suffering mental illness or developed because of that. Even things like mask wearing. And, while inherently I think at this point we can say that there was a lot of inherent social good to mask wearing in certain circumstances, it's undeniable that for some folks it also impacted their mental health. Mm-hmm. Even things as important and impactful as the absence or loss of a caregiver and financial instability that may have come with job loss, reduced hours, inaccessibility to your workplace.
I mean, we even talked about in a previous episode just how when senior or looking historically at seniors, they're more likely to be depressed or have loneliness. So now you're adding these people who are already in assisted care or in a skilled nursing facility where normally their family members would have gotten to go, check on them, are now isolated to basically on the phone talking to them. So it's a matter of, do they understand technology? Can they work it? And then do they have a chance to even talk to their family behind glass? That was actually how my grandma found out she was having her first grandbaby, was having a conversation with my sister and mom, talking on the phone, looking at each other through glass. And then it was to the point where they were still isolating her even after my sister had her baby. And the first time she met her first great grandbaby was literally through glass. So just the pure isolation and loneliness that these people were having. There's something nice about being hugged and having physical contact, and specifically those individuals, and I think there is still some sort of innate fear going around. We're in 2024 and you still walk into hospitals and people are masked up and there's hand sanitizer everywhere. And I think people are still a little scared to touch and to visit. So I think that ripple effect from COVID is still there.
Absolutely. And, just in general, I think we're continuing to see mental health, mental illness be more and more in the public eye. We talked a little bit about, and this will have been a couple months ago by the time you're watching this, but not long ago, Elmo checked in with everybody on social media and said, "Hey, Elmo's just checking in. How's everybody doing?" And unfortunately, that moment kind of went viral because the resounding answer was not that great. And unfortunately, Elmo got some pretty rough answers to that social media inquiry.
We actually were laughing because it's a lot of our millennials' childhood shows that are checking in. We even talked about Steve for Blues Clues.
During COVID,
during COVID, where, he came and apologized for going to college and just disappearing and leaving all of us. Elmo checking in and even says, "Wow, Elmo is glad he asked. Elmo learned that it's important to ask friends how they're doing." And that was his follow-up after it went viral. And it was, I mean, that's actually the initial reason we decided to do this podcast, because we're like, "Hey, did you see Elmo?" We were talking about it all across our company, and just like how interesting it is that a childhood fictional character is the one that causes people to respond in a very transparent, true answer.
Absolutely. Yeah, I think it was a really interesting social commentary on how as simple as just asking the question can get that drastic response. And I think that it does underscore how important it is to just ask people how they're doing, and looking at things like loneliness in particular, I think, is something that's really interesting to me. And the viral social media post of Elmo's kind of extends into that, where we look at things like local community versus online community, where people may feel more connected than ever through various online platforms, social media, things like that, and can connect with very specific subgroups of people that have similar interests and things like that. But it has resulted in a, I would say drastic, maybe that's not, technically true, but a pretty drastic reduction in local community engagement, involvement, just a sense of community in general. And I think that has kind of been translated into a lot of the studies that have come out regarding social media and internet usage and how it can affect your mental health. And it's not great.
Yeah, I mean, we definitely talked quite a bit about social media and how it's affecting not only the younger generation, but all the way up to our seniors, of just a lot of people are isolated and lonely. And if they are, that's the first place they go to is online. And that doesn't necessarily fix that problem of community. You've lost that. We looked up a National Library of Medicine quote, says that excessive internet use may create a heightened level of psychological arousal, resulting in little sleep, failure to eat for long periods of time, limited physical activity, and possibly leading to user experiencing physical and mental health problems such as depression, OCD, low family relationships, and anxiety. So that's already a study that's out there basically saying that if people use the internet too much, they're going to see this. But I think over time, as we continue to rely on the internet and on our artificial intelligence, and technology becomes more and more of a integral part of our daily lives, we may see more and more mental health issues. And I think more studies regarding that as well.
Yeah. Well, and I think unfortunately, as we can see, it's also drastically affecting not just our mental health, but our physical health as well. So, I mean, there's been several studies, articles, even some TV shows about this concept of blue zones, places where people have just abnormally high longevity and health. Much higher average ages than other parts of the world, people commonly living 80 plus, 90 plus years. And one of the key factors in those studies has been shown to be social interactions and sense of community. There's a lot of other things that go into it: plant-based diets, exercises, moderate amounts of alcohol, good sleep. But one of the biggest things that has been seen is good spiritual, family, and social networks. So now whatever that means to any individual person is, of course, subjective and up to that individual. But the idea that community and connection matters so much to physical health is, I think, really under-recognized and just now starting to gain some of the foothold it needs to be researched more thoroughly.
I was actually watching a Netflix show, and it might have been the Blue Zone show. I'm trying to remember which one it was, but they had asked a person who had been studying blue zones if he could recreate it. So they picked in the United States, and I think they picked a Midwestern community, and his goal was to get walking buddies, and by the end of the year, they were going to have a whole community walk where they all got together. They had a barbecue, they got to walk together, and they were going to study these people throughout the year, and the people who participated and the ones who didn't, their life, their cholesterol, their height and weight, all of that. And the people who participated and held their walking buddies accountable and would walk together actually started seeing really good health improvements and things like that. So the whole goal around it was forming a community. And so, which also went into sleep and exercise, things like that. But his goal was to get a community founded on something with a common goal. So we don't have that with, a lot of the online systems. A lot of people are moving far away from their family. We used to be kind of forced to stay near our family, and now you can hop on a plane and fly and end up wherever and have to kind of build your own communities. But it's hard, finding your own community. It's easier just to hop online and talk to people you don't always know, or talk to your family and they're FaceTiming. You don't get the hugs. You don't get that community feel. So I think that is, a combination of the internet and also just loss of community.
Yeah. Well, and especially in that senior population, or that, more traditionally Medicare age population, with so many people being, considered to be socially isolated, it does have those real health impacts. 50% increased risk for dementia, significant increase, around the 30% mark of heart disease and strokes. associated with much higher rates with depression, anxiety, and suicide. Loneliness among heart failure patients, 4 times increased risk of death, 68% increase in hospitalization risk, and emergency department visits, around 57% increase. So it does have these real health impacts, and there are some major, as we kind of bring it back to the less cerebral and the more what do we do with this burden of knowledge that we now have, bringing it back, there are a lot of barriers to getting help. And there are some unique challenges faced by providers, by insurers, by carriers, by everyone in the ecosystem. And one great example is for employer plans. So an employer wants to offer a group insurance plan. That's great. They can offer that. They got minimum standards they have to meet. One of the big things that has been talked about, and a term that you'll start hearing more and more, is mental health parity. So having an adequate number of mental health providers in network compared to the number of enrollees and the size of the network. And there's a bit of a mismatch right now. So even though the employer is not the one developing that network, not the one building that plan, if there are not enough mental health providers in the network, the employer is the one who can get fined for not having an adequate network. So I think it does kind of shift the blame to someone who is least equipped to deal with the problem. And I think that's why it's one of the big NABIP talking points, and a big industry talking point right now is how do we develop that mental health parity while keeping the people accountable that are responsible for developing networks and things like that.
Yeah, I think that's a really good point in terms of like industry topics and kind of something that's big in the news right now. And we'll probably see a lot more on mental health. Some of the things that we were both talking about of like additional healthcare trends regarding mental health is virtual help, because we were talking about how the internet can be a negative. Well, it can also be a positive for mental health. If you've scrolled through any social media, you've probably seen companies like BetterHealth or Calm or meditation apps or things like that, where they're basically reaching out to people to like seek out help and kind of diminish that stigma of it's okay to ask for help. It's okay. Like, please reach out. Please call us. It just takes away from some of the commitment of like, okay, now I've got to get in a car. I have to go meet someone I don't know. I have to talk to them, versus like you could be comfortable in your own house and like, pick up the phone and talk to someone.
And on the Medicare side of the equation, there's been a couple big changes. And I think the big thing to remember with Medicare is around 97% of doctors accept Medicare assignment, meaning they accept the Medicare rate as full payment for their services and are willing to accept and bill Medicare. Of providers that do not accept Medicare assignment, nearly half of them are psychiatrists, meaning mental health providers are one of the highest rates of providers that do not accept Medicare as full payment, which makes it very difficult to get access to care. But one thing that CMS did do on January 1st, 2024 is add marriage and family therapists and mental health counselors as someone who can bill Medicare for certain mental health services. So luckily, as of the first of this year, those 2 new provider types can bill Medicare independently for diagnosis and treatment of mental illness. They're going to get paid about 75% of the rate that a clinical psychologist would pay under the physician fee schedule. So definitely not the most ideal situation in terms of compensation, but it is a step in the right direction of increasing access to mental health services for those on Medicare. Now, has there been at this, the time we're recording this, we don't really know yet. It's still early in the year. We'll keep an eye on it, but have a lot of this type of provider actually enrolled in Medicare to become a participating provider, yet to be seen as negotiations continue to go on every year on the physician fee schedule. We will likely continue to see this develop. But again, with psychiatrists being a huge chunk of non-participating providers that are not pediatric doctors, this is definitely a step in the right direction for mental health parity for those on Medicare.
Yeah. I think you covered that section really well, because we just want to make a point of like, it's a topic, CMS is making a point, but there's still an issue of billing and who is actually accepting Medicare, which is, I think, causing a lot of people maybe second guessing getting that help, because now they're paying more out of pocket, where that person doesn't actually accept Medicare or accept assignment. So we'll see more of that. But I do want to jump into carrier trends, because we're also seeing a lot of carriers trying to help with the symptoms of depression. We listed off a whole bunch in the very beginning of, like, exercise, things that help you not be depressed, exercise, limiting alcohol, having a community, things like that. So in terms of carriers, we're seeing, especially Medicare Advantage carriers, we're seeing some supplements add a couple of things, but mostly on the Advantage side, things like Silver Sneakers or Renew Active, which are going to be gym membership discounts, or even virtual training where they can pull up their screen and do some sort of like yoga or exercise at their own house. One of the fun things that we saw, I don't know if it's still a thing, but one of the carriers created fake pets for a while. So it was like a cat that would sit on your lap and purr, but it was a robot. And they were offering that out to seniors because, they're sitting in their skilled nursing facilities or their assisted living and they're lonely, and having pets can help combat that loneliness. And even if they couldn't maybe mentally or physically take care of an animal, they could have one that they could pretend was an animal.
Well, I think you're also seeing a lot of other trends with, there have been in the past some carriers trying to offer companionship services to help combat loneliness and things like that. And I think these are all, again, mental health parity is a term you're going to start hearing. I think the other resounding thing you'll continue to hear from us and from others in the industry is that we're taking some steps in a direction. It may not be exactly the right direction, but I think things like access to, workouts and things like that, there's Silver Sneakers, the robotic pets to help with loneliness, the services that'll have companionship services. I think these are all good Band-Aid type solutions, but they're not a replacement for actual mental health services.
Yep.
And as much as we're doing to help combat loneliness and things like that, there's still a lot of work to do to build those actual mental health services into plans. And we're going to continue to see some of these like fun, trendy benefits that can provide a real, tangible benefit to people suffering from mental illness. But again, still not a replacement for actual mental health services, unfortunately.
Sure. One of the last things that we did was we deep dove into what are the 21 chronic conditions. And when you're looking at those chronic conditions, there are 21 listed out by CMS that specifically are what most people in the United States are suffering from. Mm-hmm. Out of those, you'll see things like alcohol, drug abuse, depression, and schizophrenia, which we had talked earlier about as being symptoms of mental health. So we're even defining our 21 health chronic conditions as separate entities that is encompassing mental health. So I think we still have a little bit of ways to go to actually define mental health, because that was not listed as a chronic condition. But I do think we're hopefully moving in the right direction. We're recognizing it more. It's not just a female disease. We're not coining the term of shell-shocked or PTSD and just saying, oh, you're a veteran, just, deal with it. So I think that's another thing we're doing is we'll see a lot more trends of how do we use technology to our advantage? How do we combat some of the loneliness issues and some of the other symptoms like the drug abuse, the alcoholism? So it's been interesting to kind of deep dive into not only the history of mental illness, but also trends, governmental affairs, things that the government's working on, the lack of doctors accepting Medicare, and just diving into what is mental health today.
Yeah, and I think as an agent, the big takeaway I want you to have is if you're an agent or agency owner, there is a whole new class of people that you should be networking with. These marriage and family therapists and mental health counselors are going to be a great new resource for you. Use that provider search tool on Medicare.gov to find this class of provider in your local area that's already accepting Medicare, or to look for providers that maybe aren't yet accepting Medicare. Maybe they're choosing not to, maybe they just don't know they can. But again, great potential referral partners, potential resources for your clients, and then start looking for other local resources. Are there group counseling sessions? Are there local resources through voluntary action centers, area agency on aging, things like that that can help out with your client's mental health needs. Even things that can tangentially provide benefits in combating loneliness, something as simple as Meals on Wheels or services that go check on seniors periodically are great resources to connect your clients with, and then adding mental health into your discussion as you start planning with those clients for their long-term needs. So it's really about changing the direction of your discussion with clients and making sure that you're not just physically taking care of them, but making sure that they are, equipped mentally for that aging process so that they have not just a quantity of life, but a quality of life.
I love it. Thank you so much for watching another episode of Medicare Industry Insider, and we'll catch you next time.